Hi, welcome to Your Health Matters. I'm Scott Kern. You know, as Kingman grows, our medical needs are growing with it. And here at Kingman Regional Medical Center, we're doing our part to make sure you have the primary providers you need to stay healthy and keep an active lifestyle. Today, we've got a great guest. We're going to talk about women's health with her. She's our newest nurse practitioner, and it's going to be a great show. So stick around and we'll be right back. Hi, welcome back to Your Health Matters. I'm Scott Kern. Today, our guest is our newest nurse practitioner here in Kingman Regional Medical Center, Lori Grant. Lori, thanks for being on the show.
Thank you.
So, tell us about yourself. Let's start from the beginning. Are you from here? Where are you from? What's your story?
Okay, so I originally was born and raised in New Mexico, and then I moved to Kingman in '97. I became a nurse and started working at Kingman Regional at 2004. I've been a nurse since then, and then I went back to school, got my bachelor's, got my master's, and I recently graduated from Georgetown. And
really?
Yes.
That's pretty impressive. So you graduated from Georgetown University, the one in Washington, D.C.
Correct.
With your nurse practitioner.
Correct.
That's fantastic. So you've been a nurse for 11 years.
Yes.
What departments did you work at here at KRMC?
So I primarily worked in the emergency room, and then I did the last 3 in nurse administration, working as a house supervisor.
Okay, so I'm sure getting your teeth cut in the ER as a young nurse was probably pretty interesting, and you saw some things that really kind of drove you on to go get your nurse practitioner, huh?
Correct. So there is a lot of chronic medical problems, and that's U.S.-wide. And so, but because there's a lack of primary care, they tend to present to the emergency room with non-emergent needs. And so seeing the long-term effects of high blood pressure and diabetes and how they present, my thought was, okay, let's try to catch it earlier than when they're coming to the emergency room.
Makes sense.
And in my thought process, I thought, okay, who do you see every year? And it's as a female, it's your GYN, it's your women's health provider. And so I started researching it, and I shadowed a women's health nurse practitioner for over a year before I decided to go back to school. And that's what I decided I wanted to do.
Wow. So it was a whole long journey. It wasn't just you woke up one day and decided you wanted to be a nurse practitioner.
Correct.
You just kind of just got tired of seeing everyone present themselves to the ER.
Well, so many of your chronic medical problems can be prevented. And that's something that primary care does.
So you've been practicing, you just recently started at Kingman Primary Care Physicians, or?
It's now, they just recently changed the name, and so now it's called KRMC Primary Care on Wallapai Mountain Road.
Okay, so you're located up on Wallapai Mountain Road with other providers.
Correct.
And you see just women, or do you see children too, or?
So my general age range is between 13 and up. Women primarily. Guys, I generally only see for infertility and sexually transmitted diseases.
Okay. Georgetown, what's the process to become a nurse practitioner when you're in college? I mean, how long is the schooling for it?
Okay,
and what made you choose Georgetown too? And we're just gonna talk about some of that history as far as where you wanted, like, why you chose Georgetown, what the process was
over someplace local.
Over someplace else, or
yeah.
like some of our online universities.
Okay. So Georgetown is a prestigious university, and it was expensive. We'll just put that out there. But you got what you paid for. And so the training that I received was amazing. Some of my instructors, almost every single one of them either held an office in some kind of a national organization. They were the authors of the books, of the textbooks we were reading, and they had been in practice for 30, 40, 50 years. Wow. I mean, they were amazing. And so to have that training, I that's what I wanted. So I chose Georgetown for that.
Now, did you have other options that you were looking at too, or is it always just Georgetown when you?
No, I looked at a couple of different universities. University of Southern Alabama is another amazing women's health specific nurse practitioner program. But I figured I'd try for Georgetown first, and I got in. And
well, if you get to the best first, you might as well go there and not worry about the rest. So did you actually move to D.C. for a couple years, or did you
So
commute?
the way that it worked, it was a hybrid program, and so it utilized audiovisual technology. We had class every week. It almost looked like the Brady Bunch. So everyone was on camera. We all talked, communicated. We did presentations, and then they placed you in clinical settings across the United States because clinical settings are hard to come by. Everyone's vying for the good positions between medical students, residents, nurse practitioner students. And so they purposely chose really great clinical sites as close to your home as possible, but without jeopardizing your training.
So where did you do your clinical studies at?
So I did most of my training down in Yuma, which is here in Arizona. It's quite a bit larger community. People don't think that.
Well, it increases in the wintertime with snowbird season. I grew up going down there. My family's from there, so it's a nice little town. At least it was.
It still is, and so it's about 100,000. But then on the other side of the border in Mexico, in San Luis, it's 1 million. And so a lot of that population comes to Yuma for their health care because they're dual citizens. And so they deliver and have their babies and get their women's health needs in Yuma.
Oh.
And so we were quite busy.
So you stayed pretty busy there.
Yes.
So did you, man, I was still stuck on the 1 million people. I didn't realize there's that many people in San Luis right down there.
Right.
So how long did you have to do that program
So I was
for?
down there for a year in Yuma, and the full program was 2.5 years.
Oh, wow. So you spent your weekends here working as the house staff. We would often see you working in the administration office.
On Saturdays and Sundays. And I would drive up at 4 a.m. on Monday, go down to Yuma, be there by 8 a.m. when the clinic started, stay down there till Thursday night, drive home, get here about 10, and then go to work.
Wow. So
I have an amazing husband.
You must. He's a very patient man to be able to do that for 2.5 years. But the upside is your schooling's done. You don't have to go back anytime soon unless you want to get your doctorate.
Right.
Is that in the cards at some point? Or we'll just never say never?
Never say never. But my family would disown me if I went back to school right now.
So let's just say we're good with a nurse practitioner license. And Kingman's lucky to have you back. I mean, so you're essentially a local girl now that's started here, worked your way up, and then went back to school, and you're coming back to give more to the community. You're coming home to the community. It's because you said you have 2 kids.
I have 2 kids. I have twin 4-year-olds, and then we have an adopted 13-year-old.
So you've got quite the full house too.
Yes.
So it's important for you to be in the community, setting the example for them as they grow up.
Right.
Wow, that's very impressive, and I think we all appreciate that too. So you've done quite a bit as far as traveling back to DC, into Yuma, and now back up to Kingman. So you're here, but I think what people really want to know is what made you want to get into nursing? I mean, to start off in the ER and then work your way up to getting your nurse practitioner, that's a heck of a journey in itself. But what made you want to start this journey and go?
Okay, so before I was a nurse, I was a hairstylist, and I went to visit my uncle. He was in the hospital, and I knew that I didn't want to be a hairstylist for the rest of my life. Okay. So I looked around, and I was just visiting him at the bedside, and I saw the nurses coming and going, and I thought, well, that can't be that hard. And so I went to the counselors here at the college, and I said, okay, I want to change my major from being business administration to being nursing. And they thought I was crazy.
Oh, that's 2 different study sets.
It's a little different.
It's a little different. It's a little more math, a little more chemistry, and a little less business.
Right.
A lot less business.
So they were concerned for the first couple of semesters, and then when I completed and graduated, they decided that maybe I knew what I was doing.
Wow.
So
that's pretty impressive. Just to kind of, so it's kind of it's like a wild hair. Is that the way? Just wouldn't it be cool if I could do this? I mean,
kind of. That was my thought process. Yeah.
Wow. And obviously it worked.
It did.
So how long has this journey taken you from start to finish? So we know you've been here as a nurse for 10 years.
Correct.
So how long did it take you to do the schooling?
So your associate's is about 3.5 years.
And that's going part-time?
No, that was going full-time.
Full-time?
Your bachelor's, because you have a lot of prereqs. You have your sciences and your maths and your chemistries before you get into the 2-year nursing program.
Okay. So you have to get your associates essentially before you can even get into the nursing program.
Correct.
Oh, okay.
Yeah, and then you go on and it's an additional 2 years for your bachelor's degree, and then the 2.5 years for your master's.
So you're looking at a minimum of, if I can do the math right, 3.5 plus 2 plus another 2, that's 7.5 years of schooling total. That's
Correct.
counting your nurse practitioner school. Wow. So I can see why you don't want to go back to school anytime soon. You want to kind of take your break, get settled, and get your practice going. What was the allure to come back to Kingman besides your family being here? Was it just wanting to give back, knowing the administration and knowing you can make a difference, or?
So I've been loyal to Kingman Regional for quite a while, and I have met some amazing people through this journey, and everyone has been so supportive during all of my training. And for an example, so we have a daycare here called Little Meadows, and my girls have been going there since they were 3 months old. So during the last part of my schooling, I took a leave of absence. And one of the requirements of Little Meadows is that you are a full-time employee of the hospital. That's how they're able to provide that. And so they made an exception. And that exception came all the way up from the head of HR, from Heather Crowell, that said, yes, my girls can continue to go for quite a while I finished my schooling.
So your girls are attached to KRMC at the hip too.
Correct.
It's funny, I can actually attest to this too. I was born and raised in the hospital. My mom's been an ER nurse here for 30 years, and you know that. You work with her for a long time. But I've seen this hospital have 5 or 6 different renovations in my lifetime. I'm sure your girls will see the same thing. It's cool to see that the hospital does rally around the people that want to give back and be a part of it, like they did for you. So that's really neat. And
it's not just Kingman Regional, it's Kingman in general. The more you put into Kingman, the more you get out of it.
Absolutely.
There is so much that you can do in this community as far as community involvement, community service, and there's a lot of people that benefit from everyone that does do those things.
Well, let's talk about that after the break. I know I'm getting the signal to wrap it up for the commercial. So let's talk about what kind of community involvement we can do with your practice here after the break.
Okay.
So we'll be right back on Your Health Matters. Let's talk about what a nurse practitioner is versus a physician.
Okay.
Hi, welcome back to Your Health Matters. I'm Scott Kern, and today our guest is Lori Grant, our newest nurse practitioner at Kingman Primary Care. So, Lori, you're a women's health specialist, or you have your emphasis on women's health. So, what are some of your goals as part of being a women's health nurse practitioner here in Kingman? I mean, what are you guys working on? What can we expect to see in the community from you and for you? Okay,
so a women's health nurse practitioner is it's a nurse practitioner that specializes in women's care. So that can be anything from primary care to preventative services, as well as problems and concerns that generally only affect women, such as irregular bleeding or contraception, menopause.
Things of that nature. So
correct.
The womenly problems and events that a woman will come through her life. I don't know if they're problems, but that's just, I'm a guy, so bear with me.
You're fine.
So I know Kingman has, the KRMC has a new monthly mammogram program. Or
correct.
Tell me about this. What is this? This is a very cool thing for women to have.
Yes. So this is the free mammogram clinic. In this last month was our very first time of doing it. And so we brought in representatives from Catch It Early and the Well Woman program. And so we were able to provide free transportation, free mammograms, and then for women that didn't have a provider, I was there to help get them into the system so that they were able to start hopefully coming to see me or another provider to get the preventative screenings that they need.
Okay, so what you say, just to recap for our audience, our Catch It Early program is the hospital's breast cancer program as far as providing funding for mammograms and making sure that every woman in town over the age of 40 is able to be given a mammogram. And I think that's they just passed or were able to get some funding to do free mammograms for everyone as long as they meet certain criteria.
Correct.
So that's pretty cool to have. So, and this is the first Saturday of every month, you said. And that's going to be at the Imaging Center?
Yes.
How does someone get involved with that if they want to participate? Obviously, it's ladies only, so if there's a woman watching this show that wants to come get her mammogram or set up just to see you for the first time as a patient, what's the best way to get a hold of someone to be part of that program?
So that's two separate things. If they're wanting to come and see me, probably their best bet would just to call the office, Kingman Primary Care, and state that I'm a new patient and I'd like to see Lori Grant.
Okay.
To get a free mammogram, you can either, I believe, call the imaging center and just state that you're interested in the free mammogram clinic. I also believe that you can call public relations and they would be able to help assist you in directing you to the correct number.
Okay, so you want to talk to probably Terry Williams in the public relations department. She's very helpful and very involved with the women's health and the Catch It Early program. And I think Jennifer Rosebrock is the breast cancer navigator here
Correct.
at KRMC, and she can also point you in the right direction. And I know I work with Terry, so I kind of got a bird's eye view and an idea what you guys were doing with the women's mammogram clinic. I didn't get to go because I'm a guy, but she said it was really cool. You guys had masseuses there that were able to kind of give the women a pampering day and kind of take the stress away, because it's a very stressful thing when a woman's going for a mammogram, is it not? Or it can be.
It can be, especially if you've been out of healthcare for a while. So maybe you've fallen on some hard times and you haven't seen anyone 10, 12 years and you're concerned that they're going to find something abnormal. And so that can make it very stressful. But what was nice is they had a breast class as far as teaching you how to good breast health.
And Susan G. Komen put that on.
Correct.
So it's cool to have Susan G. Komen come over here and put this class on.
Correct.
Okay.
And then we had representatives from Arizona Dermatology. We had just quite a few people. They had it catered with food and and beverages. It was very nice.
Oh, that's nice. So it happens the first Saturday of every month. So the ladies, you just have to call and call our imaging center or the public relations department. Okay. So let's kind of switch gears here for a little while and talk about the difference between a physician, a physician's assistant, and a nurse practitioner, because there's a lot of new terms being thrown around out now, and we want to make sure people are clear on what everyone's role is, so that way they're not missaying the terms. So let's start with an easy question. I'll lob you a softball here. Let's talk about what a nurse practitioner is versus a physician.
Okay. So all three are providers. And as a provider, it means that you are able to assess a patient, diagnose them, and provide treatment. And then once it's outside of your scope, you consult and collaborate with other members of your healthcare team. So in Arizona, and it's specific to Arizona, which makes it confusing for the public, nurse practitioners can open an independent practice. So that means that they are a sole proprietor. They can advertise for themselves. They do not need a collaborating physician versus other states they do. A physician's assistant works with a physician and under another physician's license. And then a physician, everyone generally knows they can open their own practice, they can work in a group. They're limited just by their training. And a nurse practitioner is similar in that. They're limited by their training. So when a patient comes in with a complex care need that is outside of my scope, well, then I would consult and collaborate with other members just like a physician would.
So that brings up another interesting question. You're in the path of medicine. You already have your nursing degree, you have your bachelor's, and you're deciding to get your nurse practitioner, but there's also the physician's assistant out there. What made you go to this one versus as the nurse practitioner versus going to the physician's assistant?
So we've already explained that I've been through quite a bit of school.
Yes.
And so to become a PA, if I remember correctly, you have a bachelor's degree and then you go on to PA school. And so it's kind of veering off topic. They have some pros to their education and nurse practitioners have some pros to theirs. So with PAs, they don't have to specialize. They get a kind of global training, and then based off of the physician that they work with, they receive individualized training so that they can work in that specialty. So an urgent care PA gets training from an urgent care physician. A GI PA gets training from a gastroenterologist gynecologist, and then they're able to work in that specialty. Nurse practitioners go to school for a certain specialty, be it family practice, dermatology, acute care, and then they're limited to just
that scope.
Population.
Okay, that makes sense then. So you chose the nurse practitioner just because you wanted to be a family primary care.
Well, and then
women's health, emphasizing women's health.
So your model of care is a little different also. So nurse practitioners have, for many years, been identified as looking at the whole patient, looking at their psychosocial needs, their community needs, not as well as the illness that brought them into you. How can you make them well even if they have an illness? And so physicians also do that. They just don't get the credit for it.
Oh, okay. That makes sense. That makes sense. So you're located up on Wallapai Mountain Road with our other primary care physicians up there with Dr. Joe and Dr. Keiko and those other folks up there. So that's a pretty busy place. So I'm sure you're going to get pretty busy pretty quick if you're not already seeing patients from the time you get there to the time you leave at night. So if someone wanted to call and make an appointment with you, I know we touched on earlier, but what's your phone number one more time for patients to make the call for appointments?
They would call the office.
And that's Kingman Primary Care, and that number is 681-8704.
Correct.
That's flashing on the screen right now.
Okay.
That's special effects that can do that. So you've had a journey. You've gone from being a hairstylist to studying business management to switching gears to getting your RN, working in the ER for 10 years. I'm just going to recap here just because it's pretty interesting actually. You were an ER nurse for how long?
For 8 to 10 years.
8 to 10 years, and then on to Georgetown, which is a very prestigious school no matter what degree program you're working on, to coming back here to raise your family and work as a nurse practitioner focusing on women's health.
Correct.
That's nice. It's good that Kingman has people like that want to come back and want to give back to the community. And this women's clinic you have the first Saturday of every month. It sounds like it's a great program that's going to keep moving forward. And that's the free mammograms. So if you want to get a free mammogram, you sign up at the KRMC Imaging Center, or you call the KRMC Public Relations Department and ask for Terry Williams. They can get you set up and get you on the schedule for that. And Susan G. Coleman comes and does a breast class with that. If they don't have a primary care, they can see you. Correct. And you can give them the whole rundown. And then they have other little treats. It's a day of pampering the way it's been explained to me. So it's cool that the ladies kind of get a couple hours away to go take care of themselves and make sure they're all good health-wise. Correct. So we've had a great conversation. I appreciate you coming on the show. Okay, so we've covered your professional life. Let's talk about your family life now. Okay. You've got 2 5-year-old twin daughters and a 13-year-old adopted daughter. So that keeps you pretty active. Yes. And your husband's a firefighter?
He's a firefighter paramedic, and while I was in school, he decided that he was bored at home, and so he's starting his own business.
Now, what's he starting?
He's starting a fitness and nutrition business.
Oh, really? Oh, that's cool. So what's that called?
It's called Firehouse Fitness and Nutrition.
I have seen that truck all over town.
Yes.
That's what that is. Okay.
Yes.
So that's your husband?
Yes.
Okay. That's very cool.
Yeah.
So you guys are going to be very busy for a very long time around here between the firefighting, the paramedics, you taking care of all the women here in Kingman, because after the show airs, I don't know if you realize it, you're going to be very busy. Okay. And that's the goal, is to keep you busy so you're here for a very long time, making sure this town gets healthier. It's already on the right track, but it's nice to have you doing your part. So thank you for being on the show today. We appreciate it. We hope you can come back again and talk about some of the programs as you start them. And thanks for being on the show. We appreciate it, Lori. Thanks for watching Your Health Matters. I'm Scott Curran. We'll see you next time.